Hi, today we're going to talk about connective tissue. Connective tissue is one of the most abundant tissues in our body, and it's very variable. It can vary from cartilage to bone to adipose tissue and blood. When we think of connective tissue, we think of the glue that connects everything together or the filler of the body. There's certain characteristic important features of connective tissue. It all begins with the mesenchyme, which is the site of origin. We consider connective tissue as the binding, support, protection, insulation of our body, and aids in transportation. Connective tissue does not occur on free surfaces, similar to epithelial did. This is totally different than that. Connective tissue varies in the degree of vascularity. Not all connective tissue have a nerve supply. Most of it does. The exception is cartilage, and its purpose is also for immune protection. So when we think of connective tissue, we're going to think of cells within a matrix and a web of protein fibers and carbohydrates embedded in. It could be either a liquid, a jelly, or a solid matrix. So all connective tissues are following. They have specialized cells, so different connective tissue will have different cells. Extracellular matrix is the material in between the cells, and protein fibers, which will include elastic cartilage and reticular fibers throughout the tissue. So let's look at some of the characteristics of connective tissue. First of all, it includes cells. As you can see here, an example. Fibroblasts secrete fibers, produce these fibers, and produce the ground substance. The next one is macrophages. So macrophages develop from monocytes. And the important thing about this is that they engulf bacteria and cellular dermis. Plasma cells develop from B lymphocytes, and they secrete antibodies. Mast cells are mainly abundant along the blood vessels, and they secrete histamine. Adipose cells or adipocytes, they're filled with triglycerides, and they're important and protective around a lot of our vital organs. Then we have white blood cells, which includes eosinophils and neutrophils, which aid in not only an allergic response, but also killing off microbes that enter the cell, the tissues. The ground substance is secreted by the fibroblasts, and this can be variable. It's generally the filler, the space in between the cells. It's supporting cells and binds the cells together, and we'll look into this in greater detail. And then we've got the fibers. Collagen fibers are made up of a protein collagen. It's very strong but flexible, and it provides high tensile strength. What that means is it allows the tissue to stretch without tearing. Elastic fibers will look thinner on a histological slide. They consist of elastin, protein, and fibrillin. They provide elasticity. What elasticity means is the cell can stretch out and come back to its original shape. We see this a lot in blood vessels, skin, and lung tissue. The last fiber is the reticular fibers. So this consists of collagen and a coating of glycoproteins. They're important in providing support and strength in organs that are very dense, which include, an example would be the spleen and also in blood vessels. So let's look into all of these in greater detail. This is a scanning electron microscope, and you could see how the collagen fibers are thicker and the elastic fibers are thinner. So let's look at the cells in more detail. So again, reviewing our cells, make sure for your exams you know the definitions of all of these cells and the functions. So repeating it again, the fibroblasts, they're the most abundant. They secrete the fibers or produce the protein fibers and the ground substances. Macrophages are considered scavenger cells. So they engulf pathogens. Plasma cells secrete antibodies. The mast cells are very abundant along blood vessels and they secrete histamine. We've talked about the adipose cells. They store triglycerides and located in the hypodermis, which we'll talk about when we discuss the skin, and around our vital organs. And then there's an insignificant amount of blood cells that exists. So the ground substance, the ground substance is what exists between the connective tissue cells and the connective tissue fibers. And the ground substance, depending on where we're at, will either be fluid, like plasma in fluid connective tissue and blood. It could be gelatinous, such as in cartilage, or calcified, like we have in bone. It acts as a support median for the exchange of substances between blood and cells. Within connective tissue, we have GAGs, which trap water, and hyaluronic acid, which provides a slippery substance that binds the cells together. So let's look at these fibers in greater detail. So collagen fibers, if we look at a histological slide, will appear thicker. They're generally straight and unbranched. They're made up of a protein collagen, and they make the tissue very strong and flexible, providing tensile strength. So what does tensile strength means? Again, that you could pull on it and it won't tear. Where do we need this? We need this type of fiber where we have tendons and ligaments, or primarily collagen fibers. And also we have collagen in bone and cartilage. Number 2 are reticular fibers. So reticular fibers consist of collagen and a coating of glycoproteins. They're important in providing support and strength in the stroma of some dense organs, such as the spleen. Elastic fibers, histologically, they appear very thin. You see thin tissues versus the thicker, little unbranched tubes are the collagen fibers. So elastic fibers have the protein elastin and fibrillin, and they provide elasticity. What does elasticity mean? That you could stretch it out without it, you could stretch it out and it's going to come back to its original shape without tearing. So where do we have this? In skin, blood vessels, and the walls of lung tissues. Oops. So let's look at the classifications of connective tissue. So the common origin is the mesenchyme. And then from the mesenchyme, it's going to develop into connective tissue proper, supporting connective tissue, and fluid connective tissue. So we're going to divide each of these up in categories and look at each of these in more detail. So connective tissue proper is made up of 2 types, loose connective tissue and dense. So just like the term indicates, there's fewer fibers and more ground substance, meaning there's more scattered cells with a lot more ground substance and fibers and loose connective tissue, versus dense connective tissue. There's going to be more fibers, less ground substance in this type of tissue. So let's look at the first one. Loose connective tissue includes areolar tissue adipose tissue, and reticular tissue. So the mesenchymal connective tissue gives rise to all other connective tissue. This is located in the umbilical cord of the fetus, and its main action is for support. Loose connective tissue, we mentioned, includes areolar connective tissue, adipose, and reticular. So this is considered as the packing material, cushions, supports, stabilization, and surrounds all our tissues in our body. So let's start with the first one, areolar loose connective tissue. One of the important details of areolar loose is that it has all three fibers. It has collagen fibers, elastic fibers, and reticular fibers. It also has the cells that we've mentioned in the past, and it's all embedded in a semi-fluid ground substance. This is the most widely distributed type of connective tissue in the body. Common areas that we'll study in the future is that subcutaneous layer underneath the skin, the papillary superficial region of the dermis. It's going to be around mucous membranes, blood vessels, nerves. So we call this the packing material because it's all over. Function of areolar is strength, elasticity, and support. So let's look at what this will look like on a histological slide. So you can see areolar loose connective tissue, the cells, these are the fibroblasts, and it has all three kinds of fibers. So it has the collagen fibers, the elastic fibers, and reticular fibers. Note that the collagen fibers are thicker, the reticular fibers are the thinnest, and the elastic fibers are the thickest, and reticular are in between. So these are the common characteristics. It's the most common one, number one, and it has all three fibers, and it provides strength, elasticity, and support. Certain characteristics of areolar connective tissue are, as we mentioned before, it's a major shock absorber. Since it's loosely organized, it can stretch without damage. One of the common locations is in this subcutaneous space underneath the skin, which we'll talk about in greater detail. Areolar connective tissue is highly vascular, so very, very vascular. Have you heard of a subcutaneous injection? Because it's so vascular, this is the region that often in medicine we use for subcutaneous injection because there's a lot of capillaries there, allowing gas exchange and nutrient deliveries to occur in this area. Another thing to note is the areolar loose connective tissue located in this area will allow us, if you can imagine, if you pinch the skin around your abdomen, it's going to move freely over the muscles. So that areolar loose tissue is located there and prevents the connection between the skin and the muscles. Adipose connective tissue is a form of loose connective tissue, and these have these cells called adipocytes. So the important about an adipose site is that it stores triglycerides or fat cells. Also, it serves as a protector means around a lot of our important and sensitive organs. And let's look at what this looks like. So this is an example of adipose connective tissue. You could see the fat storage, and you know it is adipose connective tissue because you could see the fat cell, and it's pushing the nucleus to the perimeter. There's two types. The more common one is the white adipose tissue, which functions in insulation around vital organs and energy reserve, and also supports, primarily supporting and protecting. There is a brown Adipose, not present in adults, and it's only present in newborns and generates heat. Reticular connective tissue is the third type of loose connective tissue. It has an interlacing network of reticular fibers. This one is located in the stroma of dense organs, which includes the liver, the spleen, lymph nodes, and red bone marrow. So it forms a really interwoven connection within these organs that we just discussed. So the next type of connective tissue is the dense connective tissue. We just talked about loose, and dense have densely arranged fibers within the matrix, so there's less ground substance and more fibers in this type of connective tissue. And there's three kinds. There's dense regular connective tissue, dense irregular connective tissue, and elastic connective tissue. So let's look at the first one, is dense regular connective tissue. So in this one, it's made up of collagen fibers, and all these collagen fibers are arranged in bundles that are right next to each other. So the important thing about this is it aids in very high tensile strengths. So when these fibers, for example, connect to a bone, the tensile strength is that you could pull on this tissue and it's not going to tear away that easily. So where do we see this type of tissue? Tendons, ligaments, and aponeurosis. Okay. So what a tendon is the part of the muscle that connects the muscle to the bone. What a ligament is what connects one bone to another. And an aponeurosis is like a large tendon that connects either muscle to muscle or muscle to bone. So this provides high tensile strength where you could pull on it and it would not tear. So let's look at what it looks like. So you can see these collagen fibers, right next to each other, arranged in bundles with, you can see the fibroblasts throughout here. It's going to provide strong tensile strength. So let's look at where we see this. We're going to see this in ligaments. So remember the definition of a ligament, it connects bone to bone, and it's made up of dense, regular connective tissue. It makes up tendons. Tendons is what connects muscles to bones. It also makes up these large tendons called aponeurosis. This is a large tendon we have on the top of our skull, and that's called epicranial aponeurosis. So they're parallel collagen fibers, and they're tightly packed to each other. We'll learn in the future these are the dense regular connective tissue heal slowly. So the next one is dense irregular connective tissue, and these are tightly packed collagen fibers, but they're in an irregular arrangement. So where do we see this? We see this in fascia, which is almost like a thin bag of connective tissue around our muscles and organs. We also see this in regions of the dermis, which we'll talk about when we study the integument next time. It's around this connective tissue called pericardium around the heart, periosteum around the bones, and perichondrium around cartilage. We also see this around joint capsules and membrane capsules around very vital organs. The important thing about dense irregular connective tissue that it does provide tensile strength, but because of the irregular direction and pattern, it provides tensile strength or pulling strength in many different directions. So if we look at what it looks like, histologically, it's going to look like this. You see the collagen fibers, but they're in irregular patterns. We also could see the fibroblasts, and this provides tensile strength in many different directions. So this is an example of what this dense irregular connective tissue looks like. This it's interwoven, tightly packed collagen fibers in an irregular arrangement, and it's very strong, but it's pulling strength in many different directions. So we see it around our organs, the perichondrium, which is around a thin layer around our cartilage, periosteum, a thin layer of connective tissue around our bones, and here is the perichondrium around the heart. We also see this in heart valves and fascia, which is a thin layer of this connective tissue around our muscles. The third type of dense, irregular connective tissue is elastic connective tissue. So this has predominantly elastic fibers with fibroblasts. We see this in areas that we need this elasticity, meaning it's going to stretch out and then come back to normal, including the lungs, arteries, different regions of our respiratory system. So this allows the stretching of various organs and that they're going to come back to its original shape. So let's move on to the second type of connective tissue, which is fluid connective tissue. And fluid connective tissue includes two areas, which is going to be blood and lymph. We will talk about lymph to a great extent in the next few weeks. So let's look at blood. So blood connective tissue is made up of blood plasma, which is the extracellular matrix, and the formed elements within the plasma are the red blood cells or the erythrocytes. Red blood cells are important for transporting oxygen and CO2. We've got white blood cells or leukocytes. They're important in terms of carrying on phagocytic reactions, allergic reactions, and primarily responsible for the immune system. And the third type of cell are these platelets, these little darker pink areas, and they're essential for blood clotting. So the third type of connective tissue is the supporting connective tissue. And within the supporting connective tissue, there's two kinds of cells. There are two types of tissue. One is cartilage and one is bone. So let's talk about the first one. Histologically, cartilage and bone look very similar. Bone actually starts at cartilage and then eventually hardens. So let's talk about the characteristic of cartilage. So cartilage has dense collagen elastic fibers in a firm matrix. It contains cells called chondrocytes. When you see the word cytes, that means they're the mature bone cells. So these mature cells actually are going to be located in these little houses, like I like to call them, called lacunae. So you'll find the chondrocytes, the mature bone cells, within the lacunae. Chondroblasts, anytime you see blasts, that means they're immature cells growing. They're the immature cartilage cells that produce the matrix. So the chondroitin sulfate within cartilage allows for that flexible and rubbery material that exists. The important thing about cartilage is that it's avascular. So all cartilage is avascular. So when it's injured or torn, it's going to heal slowly. How does it receive nutrient then? It's going to receive nutrition through the perichondrium. So the perichondrium, remember, is a layer of dense irregular connective tissue. It covers the cartilage and it's actually bringing nutrition to the cartilage that is avascular. So the perichondrium has an outer fibrous layer which connects cartilage to its to the outside structures, and then it has an inner layer that's going to provide nutrition to the cartilage itself. And cartilage heals very poorly because not only is it avascular, but it also lacks nerves. So there's three types of cartilage. This one actually is hyaline cartilage. We talked about the lacunae, which is this circle, and within the lacunae, we have the chondrocytes. This extracellular matrix is somewhat of a gelatinous mixture, and we'll talk about each of these in more detail. So hyaline cartilage is the most common. Fibrocartilage is the strongest, and elastic cartilage provides strength and elasticity. So let's look at these in greater detail. So hyaline cartilage is the most abundant, but it is the weakest. Where do we see this? Primarily at the ends of long bones, regions of the nose, the larynx, the trachea, bronchial tubes. So it provides, and also it's in the embryonic and fetal skeleton, which we'll talk about when we talk about the bones in the tree. So what does it do? It's going to provide a smooth surface for the movement of joints. It's very flexible and supportive. So it's with the weakest of three and can easily be fractured. So let's look at what it looks like. So here is hyaline cartilage that we looked in the beginning. You could see characteristic these little houses or lacunae, and it has the chondrocytes, the mature cartilage cells, the hyaline cartilage cells. You can see it's located between the ribs, the sternum, opposing bone surfaces. It's what makes up the fetal skeleton. Some characteristics of this, it's going to provide flexibility, shock absorption, and support. The second one is fibrocartilage. So fibrocartilage is the strongest of the three. It does lack the perichondrium. So in this one, the chondrocytes are scattered more clearly. You can see thicker bundles of collagen if we look at this histologically. So where is this located? In areas where there's a lot of, it needs a lot of support in terms of shock absorption. So we see this along the pubic symphysis, the intervertebral discs, the meniscus around the knees, and certain portions of tendons. So the function of this, it's going to support and joining structures together. It aids in strength and rigidity, and it is the strongest of the three. So let's look at this in more detail. So it's the strongest. It has very thick collagen fibers. So let's look at where it's located. So there's the fibrocartilaginous little disc called the pubic symphysis. And this is located in between the pelvic bones. The meniscus is a fibrocartilage. So this is important for resisting compression, shock absorption, and all the activities that are related to our knees. We call this one the lateral meniscus, the medial meniscus. I'm sure you've possibly heard of meniscal injuries and tears. The third fibrocartilage is within the vertebra or the bones in our back, and this is called a intervertebral disc, which is made up of fibrocartilage. So you can see it's very strong, resists compression, and a shock absorber in different parts of our body. And the third one is elastic cartilage. This provides strength and elasticity. It's not very common in the body. It's located in areas, for example, the epiglottis in the back of our throat. It's around the auricle of our ear and within the eustachian tubes. So it's going to provide strength and elasticity and is good in maintaining its shape, like the auricle of the ears. So in the second type of supporting connective tissue is bone tissue. We're not going to really go into the bone because we're going to cover bone in great detail. But as you can see, the cells within the really hard matrix, it also has similar characteristics of our cartilage, has a lacuna, but here it's a mature cell called an osteocyte. But we will go over this in greater detail in the next few chapters. So let's talk about membranes. The epithelial membranes are membranes that are protective and separate two areas of our body. So what we already learned in the past is that the epithelial membranes consist of a epithelial layer and an underlying connective tissue. Remember that the epithelium is always connected to the connective tissue because often epithelial tissue is avascular, connective tissue is very vascular, and that's how it gets its nutrition that way. There's three types of epithelial membranes. There's the mucous membranes, and the mucous membranes lines cavities that open up to the exterior. That'll include our GI tract, respiratory tract. It's important for forming barriers from the external and internal environment. Serous membranes, we talked about the serous membranes. They line the parietal layers, and that they line, for example, the body cavities, but they do not open up to the exterior. The cutaneous membranes are the skin. And then another type of membranes are synovial membranes, which line the joints and secrete synovial fluid. We will discuss that in great detail in the future. So again, the membranes that we talked about are the mucous membranes. So they line a cavity that opens up into the exterior. This is an example in our gastrointestinal system. The next one would be the mucous membranes. Oh, I'm sorry, the serous membranes, sorry. This is a body cavity that does not open up to the exterior. The skin itself, skin opens up to the external surface, which we'll talk about in great detail. And then the synovial membranes that we could see within the joints secrete synovial fluid, but we will discuss this in great detail when we study the joints. So other types of tissue we'll briefly go over here are the muscle tissue. There's three types: skeletal, cardiac, and smooth. Skeletal muscle is under voluntary control. Cardiac muscle is only in the heart, and smooth muscle is involuntary, and we see this in areas like our blood vessels, our intestines, the gastrointestinal system. We will go over all of these in greater detail. Nervous tissue. There's two types of cells in nervous tissue, neurons and neuroglia, and we will go over this in great detail in the near future.